You're correct. She's going to talk about treatment outcomes of vitrectomy, hyaloidotomy, zonulectomy in malignant glaucoma patients.
No, that not that. 31. Start. Good morning. The topic is the treatment outcomes of Plana, vitrectomy, hyaloidotomy, zonulectomy, and iridotomy in malignant glaucoma. Malignant glaucoma is defined as uniformly shallow AC with patent PI, which occurs after many ophthalmic procedures and is considered as a refractory entity. The aim of the study is to study the efficacy and safety of plasma vitrectomy, hyaloidotomy, zonulectomy, and iridotomy in malignant glaucoma in Indian eyes in a tertiary care center. The medical records of the patients were taken between December 2018 and August 2022. Patients who underwent the surgery were included in the study. Demography, diagnosis, best corrected visual acuity, and lens status were recorded. IOP, number of anti-glaucoma medication at presentation and follow-up was recorded. This is a surgical procedure. After the initial anterior vitrectomy, the Plana vitrectomy is done with a setting of 5,000 cuts per minute and 650 aspiration rate with a vitreous base shaving. And hyaloidotomy with a PC cutting is done with 2,500 cuts per minute and 650 aspiration rate. And zonulectomy and iridotomy is done with the similar settings. So anatomical success was defined as deepening of the central anterior chamber. Complete success is defined as intraocular pressure less than 21 without any anti-glaucoma medication. Qualified success is defined as IOP less than 21 with anti-glaucoma medication. Failure is defined as flat anterior chamber or IOP more than 21 with anti-glaucoma medication or patients requiring a second procedure. Coming to the results, 36 eyes of 30 patients were included. 17 were females, 13 were male. Mean age of 70 plus or minus 10. 19 underwent cataract surgery, 35 eyes were pseudophakic and 1 was aphakic. Cataract surgery was the most common primary procedure, occurred in 66.7%. Primary procedure of 16 patients were done in our hospital. 14 patients were referred to us for expert opinion. B-scan was done in all the patients to rule out suprachoroidal hemorrhage or CDs. 3 patients had aqueous pockets in B-scan. There was statistically significant improvement in mean visual acuity post-procedure with a p-value of less than 0.001. Duration between the primary procedure and malignant glaucoma was 18.2 days average. Duration between the development of malignant glaucoma and the surgery was 2.61 days on average. 13 patients were operated on the same day. There was statistically significant reduction in the intraocular pressure each post-op visit. Intravenous mannitol was given in 17 patients at the time of presentation and 22 patients 30 minutes before procedure. The reduction of anti-glaucoma medication was statistically significant for all the follow-up visits. Atropine 1% was continued in 1 month post-operatively. At 6 months follow-up visit, 19 patients were not on any anti-glaucoma medication. 3 out of 36 eyes, that is 8.7% of eyes failed. 16 out of 36 eyes, that is 44.4% achieved a complete success. 47.22% achieved qualified success, and a total success of 91.6% was achieved. This is a Kaplan-Meier analysis curve of complete success and the qualified success. Coming to the discussion. The principle of surgical management of malignant glaucoma is to re-establish a communication between the anterior chamber and the posterior chamber. Mean age was 70 plus or minus 10, and similar study by Raj et al. Studied a younger participant, that is 66.4%, 4 years. 56.33% were females. Debroni et al. In their study stated that malignant glaucoma is more common in women because of the location of the lens is more forward. The principle of this surgery is adequate removal of the core vitreous that can reduce the recurrence rate compared to other surgeries. Mean IOP at presentation was 37.9 and mean for IOP at follow-up was 13.79. Raj et al. In their study, IOP at presentation was 26.25 and final follow-up was 15.9. Zarnowski et al. Pre-op IOP was 37.7. It was reduced to 13.5. So reduction in IOP in this study was comparable to previous studies. The mean number of anti-glaucoma medication at presentation was 2.64 and at final follow-up was 0.38. Similarly, Raj et al. Mean number of anti-glaucoma medication at presentation was 1.95, final follow-up was 1.45. And Balakundru et al., the mean number of anti-glaucoma medication at presentation was 2.1 at the onset and final follow-up was 1 plus or minus 1.6. There is more reduction in anti-glaucoma medication compared to previous studies in the current study. 97.22% achieved anatomical success and 91.6% achieved total success, and none of the patient had relapse. Raj et al. In their study said 87.2% as successful outcome. De Bruyne et al. Studied anterior vitrectomy, iridotomy, zonulectomy. Initially, they had a final favorable outcome, but 66% of patients relapsed. So the total vitrectomy with vitreous-based shaving in this study, the surgery prevents the secondary blockage of the tunnel that is created, preventing the recurrences. So in this, there are many studies which studied more number of eyes, but they studied different surgeries. So this is one of the studies with largest number of eyes, which solely analyzed this surgery. And previous studies had more recurrence, and this study didn't have any recurrence. So malignant, this is the example. Malignant glaucoma is an 83-year-old patient with underwent phacotrabeculectomy. Day 4 is the pre-op presentation with a shallow AC and IOP was 63. And this is a post-op picture 2 weeks with a deep AC with you can see the surgical PI. IOP is within normal limit and the patient is not on any anti-glaucoma medication. This is a bilateral malignant glaucoma. This is a post-op picture. The patient underwent surgery in the both eyes. Post SICS, patient developed malignant glaucoma. And post-procedure right eye AC is deep. Patient IOP is 14 and not on single AGM. Left eye IC is deep. IOP is 18, not on any anti-glaucoma medication. This is also a post-op picture of the patient, and AC is deep, IOP is 16, and not on any anti-glaucoma medication. What was known before the surgery is that malignant glaucoma is a refractory entity, and there are many surgical and medical treatment. Among various surgical options, newer modalities can have a better outcome. Recurrence rate of malignant glaucoma is reduced by continuing cycloplegics. This study adds is that it has a larger sample size compared to previous studies. Exclusively assess this Plana, Vitrectomy, Hyaloidotomy, and Zonulectomy surgeries, and the success rate is reported as 91.6, anatomical success of 97.22% achieved. None of the patients had recurrence because as there is a reversal of the aqueous mistillation due to tunnel effect and the total vitrectomy with vitreous-based shaving preventing the secondary blockage of the tunnel. So in conclude, even though malignant glaucoma is considered as a refractory entity, the plasma vitrectomy, hyaloidotomy, zonulectomy, and iridotomy surgery can achieve favorable outcome with reduced chances of recurrence. Thank you. Yes. All the patients had laser, PA, and surgical. No, no, sir. Don't know, sir. I don't know.
Three cases failed. No?
Yes, sir.
How were they managed?
Failed cases.
Failed cases.
Diode CPSs, sir.
Diodes.
One
Meaning,
case was failed.
failure means the control of IOP was not controlled, or
Yes.
the AC did not form.
No, AC not formed in only one case, sir.
Okay.
That AC reformation was done in that case. But other cases, one case has no PLI, other one underwent diode CPSs. So any patient.
In spite of AC reformation, the pressure did not come up. Huh? What do you mean by that? What do you mean by failure? That's what I want to ask.
Sir, there is failure mainly means IOP is more than 21 even after even after AGM.
Okay. So not the deepening of the AC was not the parameter.
That was anatomical success.
Okay, that was
taken.
okay.
That was achieved in 97%.
Okay.
Only one patient didn't have AC. That patient underwent AC reformation.
Okay.
So that's one more.
Okay. Second organ next talk is okay.